I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with Whitford Thomas Group, speaking to you today about anger management activities. When we speak to you about anger, anger is one of the 4 blocks to happiness. The other 3 blocks are anxiety, depression, and guilt. As with the other 3 negative emotions, anger is primarily driven by thought. So if you want to change how you feel, in this case anger, and change what you do, you look at the thinking that drives that. When we look at anger as far as the activities, it's important first to recognize the thinking that drives the anger. And the thinking that drives anger has 2 pieces to it. The first piece is what we call ET, or egocentric thinking. I don't like something. Something someone does I don't agree with. It's just simply your value system and playing that out in your observation of what's going on. In essence, you don't like something. The second component of anger is what we call demandingness, believing what is happening to you should not happen to you. So when we begin to create and look at anger management activities to assist folks in reducing their anger symptoms, we begin to look at not just the thinking pieces, but we'll also look at emotive pieces as well as behavioral pieces. Probably the most potent thinking piece would be next time that you feel anger, just ask yourself, what am I telling myself to feel this? We know the world out there does not have the ability to create your upsetness. You do that through your thinking. So the first question you want to ask yourself is to be much more scientific, look for the evidence. What am I telling myself to feel anger? Once you're able to identify what that thought is, from there you begin to ask yourself, is this thought rational or irrational? And a very simple way to determine whether it's rational or irrational is the thought factual or is it fictional? If it's fictional, then you change it to more factual thought and then you practice that. Again, thinking drives anger. If you want to change the anger, change the thinking. I'm Dr. David Thomas, talking to you about anger management activities.